My presentation is on the condition pediatric costochondritis. So, what is pediatric costochondritis? Well, it refers to inflammation within the chest region. So, it'll be inflammation within the joints in the chest concerning the ribs and the sternum, sometimes the clavicle. It causes swelling and pain in the cartilage that is attached to these bones, so the ribs and the sternum. And it can be painful when moving, touching, coughing, and sometimes breathing. It is the most common diagnosis of children who are experiencing chest pain. Most often, they'll usually look at the heart first, but if there is no heart defect, it'll usually be diagnosed as pediatric costochondritis due to the pain. Some causes for pediatric costochondritis will include injury to the ribs, repetitive coughing, physical strain, or heavy lifting. The treatments for this condition will be anti inflammatory drugs such as ibuprofen. You can use a warm compress or heating pad, but this disease usually goes away on its own within a few days or weeks, just depending on the severity of the condition. For my three first person sources, the first one I used was a YouTube video called My Costco Chondritis Story You Are Not Alone. It's a video of a 17-year-old boy who explained his diagnosis, causes, and symptoms of his condition. He said that he believed that it was due to him doing a certain chest exercise. He said it typically occurred after he did dips, and then he felt this pain in his chest, close to the left side of his chest, that didn't go away even after he stopped doing the dips. He went to the doctor and they prescribed him some medication and told him to go to the physical therapist. He said that the physical therapist wasn't really sure how to help him besides giving him some cream and some small exercises to do. But he said that what really helped was the anti-inflammatory drugs, but he didn't want to keep taking those for the rest of his life. So he explained how the symptoms affected his daily life and what treatments did work to get rid of his costochondritis. He used assisted devices that he described, like the back pod, that helped him get back to his daily occupation. And he talked about this back pod and showed the users how to use it. The next first person source that I found was from a web page that had past clients talk about their experience with costochondritis. This second one is from Ruby Hayes, who was a child who experienced costochondritis. She was referred to a child specialist after she experienced chest pain, and they tested her heart since that is the most serious concern. But once they realized that it wasn't her heart that was causing her chest pain, the children's specialist told her that her pain was all in her head. However, when she tried to return back to daily living, like going to school and playing sports, the pain got so bad that she had to get pulled out of both of those. So she stopped going to school and stopped playing sports, which were two occupations that she liked to do. And then she said the pain that she felt made her feel very tired and it led to difficulty in her daily functioning. The third source that I found was called I Feel Like the Only Teen with Costochondritis. It was a story on a blog outlined by an anonymous user explaining her experience with costochondritis and how it feels like she is alone in experiencing this. She said that it affects her daily occupations and described a few of the times that it has impacted her life. Like one instance, she dropped her keys and had a lot of difficulty bending down because it hurt her chest so bad to pick them up. And then she referred to her symptoms as stabbing pains, like someone was pushing a glass shard against her chest. Now, let's talk about how the personal narratives of the individuals will increase the understanding of the disease and how it will help clinical reasoning in the future. So, for the first one, the costochondritis story, it identifies what he believes caused the disease, and then he also offered a solution that he found helpful, the remission, which was the back pod. He even demonstrated how to use it, talked about how it made him feel better. And then a great comment that I wanted to put was that all the comments under the YouTube video were people who had also experienced costochondritis and were thanking him and also sharing their own stories about what helped them. So I found that as a good resource. When thinking about the Ruby Hayes case, the disease can often be overlooked in children, which is what her story demonstrated, how the children's specialist didn't believe her chest pain after they realized it wasn't related to the heart. It also talked about how it affected her daily occupation. She got pulled out of school due to the pain and stopped playing sports, which was something that she found meaningful. And it also talked about how serious the symptoms of the disease can feel, like how much pain she was in, and as a child, how that can limit her functioning. For the third source, I feel like the only teen with costochondritis, it showed how it affected children psychologically and socially. She talked about feeling alone a lot and how she felt like the only person in her school who had this pain and how it made her life a lot more difficult than other teenagers. She had a lot of feelings of isolation, and she displayed how frustrated it could be to have this condition and how even with the symptoms that it has and the treatments that people will supply, it doesn't get better quickly sometimes. And then she talks about how the symptoms felt. She described it as someone was slowly puncturing her with a shard of glass, which can help in clinical reasoning as it's a way to diagnose but also understand what people who have this condition are dealing with. Thank you for listening to my presentation. Here are the references that I used.